So lying on the back with the knees bent and the feet flat to the ground. Just want you to rest the hands on the belly and close the eyes. And here you're just going to start to pay attention to your body getting heavier towards the floor. Noticing the points of contact of your body to the ground. And just starting to slowly deepen the inhale and lengthen the exhale. Now the low back begins to get heavier towards the floor. And I want you to consciously think about the hips releasing tension so that that can happen. And then with the hands on the body, just feeling the movement of the body underneath the hands. And here you're just making that mind-body connection, the consistency of the breath, to the movement in the body, to the state of your mind. And I'll ask you to bring the inhale and the exhale to 6 seconds apiece. And that breath ratio is generally the perfect balance to regulate the heart rate and the respiratory rate so that they are in sync with one another. Now you'll move the hands off of the body and bring the arms down alongside the body. And the next time that you inhale, I want you to raise the right arm up off of the floor and reach it all the way overhead alongside your right ear, opening up the right side of the rib cage. And then when you exhale, I want you to engage the abdomen and lower the arm back down alongside the body. And then you'll inhale, you'll raise the left arm up and off the ground, reaching it overhead. And then you'll exhale again. The engagement of the abdominal muscles pulls the arm back down alongside the body. And then you'll do the right arm again. Just continuing to alternate, taking your time with the count and moving it at whatever pace is the most comfortable for you. Feeling how the inhale opens up the rib cage and the exhale creates containment in the rib cage. You'll just do one more on each side, paying attention to the breath and the movement together. And after you've lowered the left arm down alongside the body, you'll just pause there. And I want you to notice what it feels like in this space. Just the passive movements that you've already done, and how it's switched and changed the way that you felt. Checking in on the right side and checking in on the left side. Noticing similarities and differences. And then we're going to move into the movements in our lower body. So taking a nice slow inhale, 6 seconds, and you'll feel your low back lift up away from the ground just slightly. And then when you exhale, that strong engagement to the core, just like when we exercise in the park, pulling the right knee in towards the chest. The right side of the back especially should come closer to the ground and fully in contact with the ground. And then when you inhale, you'll expand the belly and lower that right foot back down to the floor. Have that nice arch in the back. And then exhale, think bracing the abdomen, bringing the left knee in towards the chest, flattening the back to the ground. And then inhale, lowering that left foot back down. But the left foot lowers because the belly lifts, and so does the low back. And then on the exhale, the right side. And we're moving really slowly today. Passive movements, nurturing the body. The inhale lowers the foot. And the exhale brings the knee into the chest. I'm just going to be quiet for a few rounds so that you can just feel the way that this plays out for you. Noticing the movement that happens in your pelvis as you go through these movements. And you'll just do one more on each side. And after you've lowered the left foot down, you'll bring the bottoms of the feet together and you'll drop the knees open. Now, if you want to put pillows or blocks underneath the outside edge of the legs to create support so that you're not in a deep groin stretch or it's not pinching the low back, go ahead and do so, because we'll spend a couple of minutes in this position, so you want to make sure that you're going to be as comfortable as possible. The hands can come back and rest on the belly, or they can rest on the thighs. That light touch is just going to help calm and soothe the body. And while you're here, I just want you to notice where you're holding tension. And if you can soften and relax that tension. At any point in time, if you need to back out of the position and bring the legs back up, you can definitely do that. And now we'll move into the opposite position. So help your legs together and take the feet a little wide, knees still bent, and then drop the knees in to touch each other with the feet wide. And this helps to get extension in the outside edge of the hip and open up the SI joint, so the sacrum. Hands can rest on the ribs or on the belly. Just aware of the pace of your breathing. And then we'll keep the feet wide and we'll bring the knees away from each other. So our knees should be pretty much in line with the outer edge of our hips, the widest part of our hips, and our feet even wider still than that. And the arms are going to come out into a relaxed T position. Now you can have a full T where the elbows are straight, or if you need to soften a little bit through the chest and through the shoulders, bend the elbows into a W position. You'll take a nice slow inhale in. Keep the feet wide, and on the exhale, drop the right knee towards the left heel and the left knee out and down towards the ground. And then you'll inhale, come back to center. And exhale to the right. Left heel comes towards the right, left knee comes towards the right heel, right knee comes towards the ground. The inhale moves us back to center. And the exhale moves us into the windshield wiper twist. Continuing the repetitions and just taking stock of the effect. Moving slow enough that you can pay attention to the subtleties of how your posture adjusts and your body adapts to the movement. The next time that your legs drop to the left, you're going to leave them there. Again, if this is too deep or if it pulls too much at all, you can take a pillow underneath the outer edge of the left thigh or a pillow or block to the inner right thigh to help create some support so that you're not being pulled all the way into the twist, Instead, you're being supported and able to relax only at about like 70 or 80% range of motion. Turn your head to look the opposite direction of the legs. And then you'll bring the legs and the head back to center. And then you'll drop the legs to the right and the head turns to the left. And you'll settle here. Breathing in and out through the nose. Consistent with your count. Then bringing the head and the knees back to center. And you're going to walk the feet a little bit closer together. The feet or the knees will not be touching, so you'll have about 6 to 8 inches in between them. And you'll bring the right knee into the chest, interlacing the hands to the back of the right thigh. And I just want you to hold it here for a moment. And as you hold here, think about that right hip socket beginning to release tension and soften. As you stay steady with the breath ratio, you're creating an environment inside your body to which you can control the release of the muscles. Just giving yourself some time and space to do that. Now I want you to flex the right foot, and you're actually going to take the hands and you're going to curl up and you're going to interlace the fingers over the ball of the foot. Now if your head comes back down and the neck is lifted high up off the ground and so are the shoulders, that's okay. You can stay there as long as you can relax in it, or you can maintain the curl. What you're going to start to do, keeping the hands really strongly intertwined, is extend the right leg up. Now, you're going to want to either drop the head, instinct is going to want to drop the head, or lift the left foot. I want you to maintain the resistance between the foot and the hands in such a way that you're using the foot to push the hands away so that the shoulder blades are opening up and the lower back is rounded. Now pick up the left foot off of the floor and just hover it there, and that's going to indicate a lot of core engagement. You should feel yourself start to heat up, but stay in control of the 6 count inhale and the 6 count exhale. And we're just going to hold for one more breath cycle. And after you've exhaled, you can lower the left foot, start to bend the right knee so that your upper body lowers down. Release the hands and place the right foot flat to the floor. And pause, continuing with your 6-6 ratio. Now you'll bring the left knee into the chest, interlace the hands to the back of the left thigh. And again, you're just going to hold the left leg here. Giving time for that left hip socket to release. Tuning in more and more to the subtler layers of tension that your body naturally holds. Then you'll release the hands from the back of the left thigh. Flex the left foot. Come up, interlace the hands to the bottom of the foot. And you want more of the ball of the foot because it forces a flex in the foot, dorsal flexion. And then you'll start to extend the left leg up. And remember, this is about core engagement. So you're using, and the strength of the leg, you're using the left leg, pressing into the hands to lift up the torso. And then you're supporting that by the strength of the core. Lift your right foot up off of the ground and let it hover there and feel the low back in connection. And it's really up to you how much you push the foot into the hands. The more you stay backed out of it, the actual difficulty increases. The more you go into it, you're relying on the tension between the arm and the legs, the leg and the arms. Feel the heat start to build. You're going to do one more breath cycle. And once you're completely done with the exhale, you'll lower the right foot, bend the left knee to lower the upper body, and then release the left foot back down to the ground. Arms kind of out to the side, a little bit away from the body. Palms facing up, breath is steady. knee into the chest. Bring the arms up to a droopy T or a W position. And then on an exhale, you're going to take the legs over to the left into a twist. So the left leg isn't as deep into the twist as the right leg is. And you can rest the right foot on the inner thigh of the left leg, or you can bring it out and create more of an extension with it, depending on how much you want to go into the outer edge of the leg and the hip. If you go all the way, you can always reach and grab the foot. You don't even have to grab it. You can just reach towards it to get more extension. But staying in a supported space where the foot is rested, you're going to get a lot of range of movement in the rib cage as well. So as you're here, and you can turn the head to look the opposite direction if you would like. As you're here, I want you to really focus on the feeling of the exhale. And the idea that I want you to start thinking about with the exhale is the idea of humming out the breath. And it's not something that you're going to incorporate yet, but it's likely to appear in practice. And just thinking about what that vibration and what that sensation would feel like, what that noise would be if you hummed out the breath. Meanwhile, trying to let everything relax as you're here. And if you would like to begin humming out the exhale, I would absolutely encourage it. I won't do it here because I don't want my noise to interrupt your noise. And it can be as soft or as loud, as exuberant as you would like it to be, but it's creating a vibration in the nervous system that helps to relax the diaphragm, but also activate the parasympathetic nervous system, kicking you more into a state of rest and digest. Feeling the vibration in your mouth and through your throat. After your next, after your next exhale, you'll come back to your 6-6 count breath without the humming, and you'll bring the legs back to center. And you're just going to cross the right ankle over the top of the left thigh. And scoot the left heel as close in towards the butt as you can. And because of the position of the right leg, the hips and the body's going to want to drop to the right. But I want you to keep your low back and the back of your hips flush. So they're going to stay equal. And then you're going to think about the tissue on the right leg, specifically the right thigh, starting to relax as if it's falling off of the bone. Now you'll uncross that right ankle and place the right foot flat to the ground. Pause there. Notice how the right side of the belly, the right side of the back, the right hip, and the right thigh feel. Even through the right side of the rib cage since we were in the twist. And then you're going to bring the left knee into the chest. And on an exhale, you'll drop the legs over to the right. And remember that you can adjust and you can switch what you do with that left leg. You can keep the knee bent and the left foot on the inner right thigh, or you can start to extend that leg out in front of you a little bit more, maybe even reach for it. And one thing that you want to begin to think about too as you're breathing is as though there's a spot in the middle of the back and it's at the very base of the rib cage, like that is dropping towards the ground. And that's where your diaphragm connects into the spine. And when you can start to harness that idea of relaxation there, the rib cage will start to open up and the diaphragm will start to mobilize a little bit better. And for now, you're just going to focus on breathing in for 6 seconds and then think about humming the breath out for 6 seconds. And the hum can always go longer as well. Just thinking about that feeling and that sensation and that sound and what that would be. And now if it's comfortable for you, you can begin to add in the hum on the exhale. Really then feeling that vibration through the body and making it last as long as possible. Noticing the fluctuation of sound, the fluctuation in the breath. And thinking about your body relaxing further. After this next exhale, you'll drop the humming and just move back to a 6-second inhale and a 6-second exhale. And you'll bring the legs back to center. And you'll cross that left ankle over the top of the right thigh. But remember that you're just putting your leg in this position. You want the hips to stay even. You want the right knee to stay pointing straight up towards the ceiling. You're just allowing the left leg to be in an externally rotated position so that you can think about the muscles relaxing in a different way. Then you'll uncross that left ankle and place the foot flat to the floor. And I'm going to have you come up to seated for just a moment. And you're going to maintain the 6-second inhale and the 6-second exhale. And I want you to bring the pointer finger and the middle finger on the right hand to the spot in between your brow. And that's going to leave the thumb on the right nostril and the ring finger to tap the left nostril. So having those ready, but having that pressure against the middle of the forehead. You're going to take a nice slow inhale. And when you exhale, you're going to close the left nostril and breathe out of the right. And then you'll inhale through the right. Close the right and exhale out of the left. Inhaling through the left. Close the left, open the right, and exhale. Inhale through the right. Exhale out the left. Try to keep that right shoulder, that right arm relaxed. Inhale through the left. And exhale out the right. And you're going to continue with that pattern. Feeling the gentle touch of the fingers to the forehead. Sometimes if we become more tense, what we can start to do is we can start to dig the fingers in. That'll only make the hand more tired and in turn make the shoulder more tired. So keep the touch light. And try to relax into your body, softening that mid-back area. Listening to the sound of the breath and the sound of the count. after the next time that you breathe out of the left side of the nose, you'll release the hand. Just noticing how you feel. And then you'll transition to being on your back again. Knees bent, feet flat to the floor. You're going to maintain the 6 count. And we're going to incorporate one last movement, and we're going to utilize the humming on the exhale. And again, I'm not going to hum because I'm not going to interrupt your hum. So humming to whatever power level you feel is best, most appropriate for you right now. Now the next time that you inhale, I want you to raise both arms off of the ground up towards the ceiling and then reach them all the way overhead. And then when you exhale and when you initiate the hum, you tense the abs, lift both feet off of the floor, bring the knees into the chest as you lower the arms down alongside the body. You don't need to worry about lifting the hips up. The hips stay heavy on the ground. And then inhale. Lower the feet as you raise the arms up and overhead. Flex the feet as you lower them to the ground. The low back will lift away from the floor. And then exhale. Initiate the hum. Start to press the low back towards the floor, lowering the arms and bringing the knees into the chest, relaxing the feet. Inhale. Lowering the feet, raising the arms. Flex the feet as you do this. And exhale, relax the feet, engage the abs, begin to hum the breath out as you lower the arms and bring the knees into the chest. I'm going to let you just keep going with this on your own. After you finish up this last one, you'll just release the feet to the floor. And you can keep the knees bent or you can extend the legs. You can extend the legs and put a pillow underneath the back of the knees. You can grab a blanket. Whatever you need to just settle in here. And let your body relax. Just taking time here to feel your body absorb the benefits of the practice. And a lot of that is just by knowing how it affected you and how you feel the effects. And you're just going to go ahead and stay here for as long as it's comfortable for you.